All right, Nick, thanks. Oftentimes we get overwhelmed with comments on our Fox 4 Facebook page, but very rarely do we get a handwritten note. But last week, we got a letter from a woman with a question for the Executive Dean of Kansas City University, Dr. Darrin D'Agostino. Good morning, Doctor.
Good morning, Abby. How are you today?
We're doing great. Thank you. Trying to stay warm. All right, so I'm going to start by reading this letter. It says, to Fox 4, I have a question for Dr. Darrin D'Agostino about the vaccine shot. I'm an elderly woman who only weighs 92 pounds, was wanting to maybe get the shot, but can use a butterfly or smaller needle in your arm because I don't have much of a muscle. That needle is pretty long. Just wondering if it's okay to get it with such a small arm. I would have emailed you, but I don't have a computer. I watch every morning. So thank you from a viewer. And we appreciate this. And just goes to show, we read your comments, everybody. So what do you say?
Well, absolutely. I'm really happy that that question was asked. And it is an important question because most people don't realize we have a lot of different size needles and people have different size arms. And this vaccine is not going to do the job unless it gets into the muscle. So for people who are really less than about 130 pounds, we have to think about a shorter needle because we really don't want to take the needles that are being distributed with the vaccine, which is generally about 1.5 inches to 2 inches. It's actually 1.5 inch needle. And what's happening is we have to then not put the needle in all the way in order to make sure it's in the muscle. All right, and that also decreases risk. But here's the thing, you can switch that needle out, and it is recommended that she would use a 1 inch or even a 5/8 inch needle, very short needle, to get into that muscle. They're very thin and they work very well, but only on people that don't have a lot of fat tissue overlying the muscle. So what I would do is ask if they can change the needle out, or if possible, call ahead if she knows where she's getting the vaccine, to ask them to do that. It is possible. It's not our usual for this vaccine, but these are professionals that know what they're doing and they'll be able to get it into her arm. So it's a great question. I really appreciate asking it. Most people don't ask, and it's important for us to be educated consumers.
Yeah, absolutely. I agree. It's something I never even considered, but I'm sure there are people who are wondering the same thing. So another question that we had, if your parents are vaccinated, but you are not, is it safe to visit them?
Well, it's safer. Okay. I wouldn't say it's 100%, but it's safer as long as they've mounted a response. And that's the key to my answer, is as long as they've mounted the response. So age plays into this, any other comorbidities or illnesses that they may have. So the safest thing to do if you're going to be visiting is ensure that you're still wearing a mask. And until we know that everybody has this immunity, it is still best to maintain at least a 6-foot distance from those people. Now, even though they've been vaccinated, they can still get infected if they're going out. So to protect yourself, you want to make sure that you're keeping that distance. Remember, the vaccines only protect against disease developing. They don't protect against getting infected. In fact, you have to be infected for the vaccine to work. Your immune system only works on the inside of your body. So you have to get the virus in you. So still wear your mask, maintain your distance, go ahead and visit, but do it in the right way.
All right. Not out of the woods just yet. All right, Dr. D'Agostino, I certainly appreciate it. And we'll check in back with you. What day is today? Is today Tuesday? It feels like it's been 2 weeks of a week already. We'll see you on Thursday.
Today is snowy. That's what today is.
Yes, it is. All right. Thank you. Mark.
Take care.